And we're pleased to have with us a representative from Fallon Health, Andre Gabryjelski, who is the Director of Medicare Services. Welcome, Andre.
Thank you for having me.
Andre, we're going to get into a little bit about open enrollment and things that individuals, employees, and employers have to deal with as it relates to selection of healthcare plans. But, you know, for our viewers, we hear the words nationally in a presidential season, Medicare and Medicaid. Maybe just maybe we could explain the two for our viewers.
Briefly, Medicaid is a state-run program where Medicare is the federally run program. So when you turn 65, you automatically are eligible for Medicare Part A, whereas the Medicaid program there's more financial qualifications for that.
Right. And so with the benefits of people living longer, healthier lives, if they follow what Fallon Health tells them to do, they're working longer. And so employers and employees, when they reach that age of 65 and they become eligible for Medicare, there are decisions that need to be made.
Yeah. We're actually changing the classic definition of what an age-in is. It used to be you turn 65, you retire, and you get on a Medicare plan. Like you said, now we're seeing people work till 67, 70 years old. And a lot of people are electing to remain on their commercial coverage through those years. So just the decisions that need to be made, they're changing as people work longer.
And how do people do that kind of cost-benefit analysis? What's good for them individually? What makes sense for their employer?
And the employer too. Right?
How do you have that conversation?
I think from the employer side, it's mostly just about what is coming up next and what the options are. So it's just being prepared to answer those Medicare questions, and then depending on the size of the group, can they stay on the commercial plan or should they go on a retiree plan? We also tell people to talk to their insurance broker.
Mm-hmm. And that's something, so you know, we've had a number of conversations about on the show, especially with 80% of our chamber member businesses being small businesses.
Yeah.
You know, you're trying to make the widgets or you know, get your product, you know, deliver the services that people hire you to do. It's hard to stay on top of the rapidly changing healthcare world. So many small businesses use brokers who work with companies like Fallon Health.
Absolutely.
So, you know, you say people should chat with their broker, both the employee, the employer, both?
Both.
Yeah.
Both. The brokers are really, you know, they're not Fallon employees, but they represent our products. They do a great job, not only in the Medicare space, but in the commercial space.
And generally speaking, they have a few different healthcare companies that they work with, but they're the ones that
They do. So they're objective. They are trusted advisors, we call them.
Right, right. And so we know that as open enrollment season begins, oftentimes employers will bring those brokers in, sit down with the employer, say, hey, look, here's my cost. How do I manage this? How do I make it so that...
Right, no cost to the employer. I think that, you know, the important thing is too, like you said, a lot of the chambers are small businesses. Businesses under 20 have a nice rule where you can continue working but still offer a retiree plan. So we see some organizations taking advantage of that, and at times, depending on the makeup of the group, it can actually have a positive impact on the commercial insurance rate as well.
And a retiree plan, that's something different than Medicare?
Same.
Same, okay. And is there savings to the employer that might be involved?
Could be. So depending on the group size, the age, the makeup of the census of the group, by offering the retiree plan and changing the census of the commercial group, it may have some impact on, positive impact on the ratings.
And a retiree plan, is there any kind of, is there a definition to that or a general description of what
Well, the retiree plan, so the Medicare Advantage plans are really the Medicare is the primary insurance. And so we become the primary insurance once that kicks in. There are other Medicare plans like supplemental plans that with open networks that work a little bit differently. But I guess the major definition is it's not a commercial plan. It's for people that are over 65.
And a supplemental might be where the individual and or the company decides to pay a little bit more to have some extra coverage beyond what Medicare. Medicare. And the open enrollment period, is that one specific time, or is it for every company? Or?
Yeah, so for open enrollment, each organization, each employer can have their own open enrollment, but generally speaking, the open enrollment for the population just started a couple of days ago. So it's October 15th through December 7th.
Mm-hmm. And that is for the Medicare piece?
Medicare piece. So this is the one time of year where everybody has the opportunity to shop all the different plans, look at all of their different options, and make a choice ending December 7th that will impact the entire next year.
Okay.
So you make a choice during open enrollment, and that's really your plan. We call it, you're locked into the plan for the entire next year.
And are we talking just Medicare or just all companies in terms of what they offer their employees?
So this is Medicare.
Medicare.
Most of the small employers, they can define what their open enrollment period is, and they can make those changes mid-year if they elect to.
We seem to see a lot of it after the first of the year into the spring with some companies and municipalities. But as people, this open enrollment period, as you said, exists for the next couple months or mid-December. How do people dig in, educate themselves as an individual, an employee, as an employer?
Yeah.
You mentioned talking to their brokers, but is there more places they can go for information?
There are, and it's funny, this time of year people will be bombarded with marketing materials from not just Fallon, but all the other carriers. I think the easiest way locally, we have the Fallon Info Center on Route 9 in Shrewsbury and White City.
Right.
We have representatives there that are experts on all the products. So it's open to everybody. It's open to commercial members, employers, brokers, Medicare recipients, anyone who has any type of healthcare question. We have folks that are ready to help them right on site.
Right. And great location, parking. Also, I think a website here. We got fallonhealth.org/Medicare.
Please visit.
Educational materials and resources. And I guess you mentioned why this is an important time frame. People are locked in.
They are.
Yeah. So
they are. So we make sure that not only do we have the info center, we have a great customer service team if people call in, but we also have, I think we have 60 community events lined up between now and December 7th where people can come out. Those events are promoted on the website. They can come out and sit with a group of people and talk about the options and talk about the next steps. So we encourage people as much as they can come out face to face and have these discussions. It's an important time of year.
Right. And we just have a moment left. But so for people who hit that magic age of 65, they have that choice as we talked about Medicare. But as an employer, is that something in terms of plans? Are there incentives for you to offer those retiree plans, or is there kind of a choice?
So we touched a little bit on it depending on what the group census looks like, but to the employee there could be some benefits that are better than the plan that they had.
Great, and that's a good thing. And as we talked about from the
everybody wins
from the beginning, people are living longer, working longer. In some cases, they have no choice. Other cases, they want to be. Keep busy. But, well, good stuff. Andre, I want to thank you for being with us. Andre Gabryjelski, the Director of Medicare Services for Fallon Health. And people can go on fallonhealth.org to learn some more about it, and also at White City, the Fallon Information Center if they want to learn more. So.